Hello, my name is Dr. Jeremy Rode. I'm a respiratory physician practicing medicine at Vancouver General Hospital. I'm going to talk today about the importance of maintaining a healthy diet. We know that a healthy diet for all of us is important in maintaining muscle strength, bone strength, and our immune system, which is very important in fighting infections. When you have moderate to severe COPD, the energy required to sustain your breathing is more than normal, so that it becomes even more important when you have this severity of COPD to maintain adequate amounts of nutrition. Otherwise, there will be wasting and loss of strength, which can impact on many things in your life. In Canada, we are fortunate to have a wide variety of foods available to us. These foods can be broken down into three major groups. Ones that have a protein base, a fat base, or a carbohydrate base. And it's important to maintain a balanced diet so that all three of these components are ingested. When buying food, it's important to look at the labels and understand how much of each of these major food groups is in the certain foods that you're purchasing. Try to avoid foods that have excess sugar, salt, or fats. Eating a variety of foods from all the different food groups will help you to maintain a healthy diet and get the nutrients you need. The type of diet you have depends on your weight and your underlying health issues. I think it's important to discuss these issues with your doctor. For example, finding out what your ideal body weight should be so that you can adjust your diet appropriately. And also, if you have an underlying health problem, for example, high blood pressure, certain substances should be avoided, for example, salts. Or with heart disease, very important to reduce the cholesterol intake. With COPD, it's important to maintain a wide variety of food groups and nutrients, but there are no particular hazards associated with COPD. It's more important to just get a balanced diet. In regards to your ideal body weight, it's important to talk with your doctor and a dietitian about the amount of calories that should be consumed on a daily basis to help correct this problem and also deal with your underlying health issue. You may also get advice on the use of supplements, which can be helpful. Here is a chart depicting the different food groups. Based on this, your physician or a dietitian can advise you how much from each food group would be advisable to use on a daily basis. This will help to adjust your weight and make sure you're getting the appropriate energy that you require. Consuming food high in nutrition is important, as you can see from the chart. When you have COPD, the overeating or eating too much at one sitting can lead to a feeling of bloating and difficulty breathing. It's particularly true if your COPD is more advanced. In this setting, we advise that you eat more frequent small meals to avoid this bloating sensation. This can also, by virtue of the way foods are broken down when you eat them, can increase the demands on your breathing. So if your COPD is quite severe and you eat a large meal, it can make your breathing a little more difficult for a period of time. So that, again, eating more frequent small meals is important. Eating itself can be a chore, so try not to eat too much or put too much in your mouth so that you have to chew excessively. And if you're finding that you are getting short of breath just through the act of eating, taking additional oxygen may be of benefit. Another thought may be, if food preparation is becoming difficult, to get a family member or have your community supports which are available to help you prepare your food so that you can ensure you're getting adequate nutrition. While eating is important, it is also important to get adequate amounts of fluid, particularly water. It's important to help keep your mucus thinner so that it's easier to cough and expectorate the mucus or huff it out. And so you should talk to your physician so you get an idea about the amount of liquid you need to consume, water in terms of cups of water on a daily basis. Being aware of your diet is very important. I think we take for granted what we're eating and sometimes don't take a bird's eye view of it, so that charting and documenting what you're eating on a daily basis can be very helpful. You can use this to get feedback from your physician or your dietitian, and also help you to plan your meals in the future. This associated chart gives you an idea of how you would plot your daily food consumption. We're nearing the end of this video, so I'd like to take this opportunity to invite you to review it again, just to be sure you understand the concepts we're putting forward. And otherwise, thank you for your attention. And I'm going to now quickly summarize the key points of the talk so far. Protein, such as lean meats and fish, will give you the most energy. Think about how much you are eating. Make eating easier by eating less at one time and eating more frequently. Choose foods you like that are easy to prepare and eat. Drink water often and throughout the day. And more information can be found in the pamphlet which will accompany this video. Thank you for joining us today, and I wish you happy eating.